Monica, I'm glad we have a few minutes that we can sit down and talk about how your discharge teaching went. So thanks for meeting me in the conference room. How do you feel like it went with Mr. Smith when you were giving his instructions about when to take his antibiotic?
Seemed like it went okay.
All right. Do you feel like you were really able to assess whether or not Mr. Smith understood the information that you gave him?
I think so.
Okay. What I observed was you asking a lot of yes and no questions to Mr. Smith, and I saw him shaking his head yes to you. But it's really important that we make sure that the patients understood the information that we taught them, especially with things like antibiotics. Their infection could get worse, or it could be a really unsafe situation if they take too many of their antibiotics at one time. You should use the medication teach-back strategy that you learned last week in your class in order to assess whether or not the patient really understands if you're taking the medication. So just to remind you, medication teach-back is when you have the patient verbalize what you taught them in their own words, and then you can really kind of understand if they understood what you taught them. So moving forward, when you're giving discharge instructions, I want to make sure you do use that medication teach-back strategy. Do you feel like that's something you'll be able to do?
Yes.
Okay. Is there anything I can do to help make it easier for you, or to ensure that you're able to use that strategy?
Maybe if we just practice a little.
Okay, yeah, we can definitely do
just
that.
so that I'm asking the questions, just to make sure that I hear his understanding a little better.
Okay, that sounds great.